Wilkinson, Boulder County Public Health, Child Health Promotion Coordinator. And we will be recording this meeting. So if you miss it or have to leave or would like to show it elsewhere, I'll be sending out the recording and the PowerPoint in the next few days. So thank you. If this is your first time, or maybe you've forgotten, it seems like it's been a little while since we've done this meeting. That format will start with a communicable disease update from our friend Martha Hintz, and then a change to the agenda. We are not doing the indoor quality grants. We already did that from last time, so you already have information on that. Nothing new to report, but we do have a couple folks from our emergency management office talking a little bit about how to ensure that you're prepared for a variety of emergencies, and then our partners to chime in, and we'll end it with an introduction to how we want to use the other 2 months of each quarter with some health promotion. We're calling it Whet Your Appetite. So we'll tell you, Kyla and Tori will tell you more about that at the close of our meeting. So again, thanks everyone for tuning in, and I'll turn it over to Martha.
Okay, well, hello everyone. I'm Martha Hansa, and I'm the person who answers and replies to most of the email correspondence when you write to our health ECE at bouldercounty.org inbox. And I've worked at BCPH since September, and I've enjoyed getting to know you and learn from your expertise. Many of you have been ECE directors for over 20 years, so it's been good to get to know you and learn from you. And I'm the bridge between the ECE partners and the communicable disease department at Boulder County. So my goal is to help prevent the spread of diseases, which are particularly common to child care facilities. So thank you for your great questions when you reach out to me. And to begin with, we have a communicable diseases quiz. It's called Can You Catch It? And it's just one question. So the question has to do with measles. And measles, the hallmark of measles is that a person would get a rash and a fever as high as 105 degrees Fahrenheit. So the question is, a person with measles sneezes. How long can it hang in the air and infect you? And the possible answers are A, 2 seconds, B, 2 minutes, and C, 2 hours. And go ahead and put your guesses in the chat. I love to hear all the beeps. Well done. The answer is, go ahead, Jane, you can click at the bottom. The answer is 2 hours. So according to the CDC, 9 out of 10 people with close contact to someone who is sick will get it. And interestingly enough, measles are more contagious than Ebola. Yeah, wow. Someone said, isn't that interesting? And you can get measles by breathing the same air as someone who is sick. And the problem is measles is dangerous because it can require hospitalization. And in January of 2015, we saw an outbreak with 102 people affected across 14 states. California was the hardest hit in 2015. And the people that became sick were unvaccinated, and they were often linked to travelers who brought measles to the US from overseas. So as you know, measles is a vaccine preventable disease, so we highly encourage you, your children and staff to be vaccinated. Okay, next slide, please. So we have been so COVID-centric the last 3 years that we just want, as we talk about communicable diseases, think about RSV, influenza, GI, norovirus, and other vaccine preventable diseases. Next slide, please. What I like to watch is the Bug Watch, and anybody can have access to this, and Children's Hospital updates this on a weekly basis. And as you all remember, during November and December, we saw an uptick of RSV and influenza. But thankfully, as you'll see now in January, with this Bug Watch graph, the red line R for RSV and the blue line is for blue flu influenza. And so you can see as of January 1st, 2023, the rates of positive specimen count has been decreasing. So now RSV hospitalizations are at comparable rates to other previous seasons. Next slide, please. And just the reporting requirements for COVID is that you only need to report to us at Boulder County Public Health if you have 5 positive COVID cases, and of those 5 cases, 2 of those are confirmed PCR tests, not the at-home antigen tests. And this is within a 14-day period. Next slide, please. And we're curious, the epidemiologists here, of how do you receive your illness information? And you can put your answer in the chat as well, because we're curious when parents or guardians call in, is it a live person receiving the phone call, or is it a voicemail? Or I know some facilities have an app, other facilities email or text, and then other facilities do other things. And some of them do all of the above. Okay, this is super helpful information, email or text, because we were wondering how would it be easiest for you to gather that data, especially when a parent or guardian tells you that their child has COVID, you know, and then if we ask you back, well, was it a PCR or an at-home test? So I think this is super helpful, ABCDE. Okay, thank you. So no one's using the old-fashioned mailboxes anymore. So, okay. Thank you. But I think what would be most helpful for us when you do the reporting on this illness log is if at some end point part on the line, you can put, was it a PCR test or was it an at-home COVID test? If you don't know, that's okay, but that would decrease, we'd be able to respond to a greater variety, more ECE facilities if you could put that on this illness surveillance form. And the other thing, we are working on closing up 29 outbreaks since November. And one part that's slowing us down is a lot of time people are printing on these illness surveillance forms, and we need to report this data to the state, and we're just having a hard time reading some people's printing. So, and sometimes people take a picture of it and it's really light. So we would highly appreciate it if every time you send us your illness log, if you could just really make sure it's legible, and if you take a picture, make sure it's at the darkest setting. And ideally, we'd love for you to type it in, but we know that some people can't do that all the time. So, but that would be super helpful and speed up our process of trying to close these 29 outbreaks. So that would be greatly appreciated. Thank you. Okay, next slide, please. And then Marilee, who's my epidemiologist partner, will talk about this one, the finger on the pulse. Take it away, Marilee.
Thank you so much, Martha. I appreciate that. I just wanted to quickly speak to how much we appreciate the time and effort that goes into providing us your accurate and timely illness logs, because they are so important. And I wanted to make sure that you had a little insight onto our side of how much we appreciate those, what the purpose of them is, and why we find them so useful. So 3 things. The first one to think about is that you all are serving a very unique population. We know that younger children's immune systems are still developing. They're not eligible for all vaccinations. And we also know that in ECEs, there's a higher rate of certain infectious diseases. And attendees are also more likely to contract an illness that is resistant to current treatments or antibiotics. So it's a unique population. It's one of the more vulnerable populations in our community. And so we want to make sure that they have extra support and attention. And I know that it's a lot to ask for one more thing on top of everything else that you're doing. So thank you. The two things that it's exceptionally helpful with, the first is for surveillance purposes. It may seem like that we have eyes and ears everywhere and we know exactly what's happening in the community, but hearing from you all is one of the most important ways that we can have an early detection of something that's new. I think one of the best examples is this fall, where we had an unheard of amount of RSV. It was out of season. It was what we were not anticipating. And we were able to sound the alarm on that about 6 weeks early because of your reports to us. So without that, you can imagine what it's like if we just suddenly are blindsided with so many people needing additional medical care and we are trying to figure out what's happening. You were our red flag. You were our early detection there. I think also one thing that is important to know is while we can always provide disease control measures, there's a lot that you all already know. But if there is something new that's available in the community, that we can make sure to share that back with you. If there's a new treatment, if there's a new process, if there's a new best practice, that you have that feedback loop with us that we're letting you know. One specific example I would say is, for example, if someone's diagnosed with pertussis, because we know that there are a lot of other children in the same congregate setting that maybe are symptomatic, we know that they will need either preventive or treatment with a certain antibiotic. If someone's diagnosed with a certain GI illness, some of those should not have antibiotics, and we need to make sure that no one's taking them so they're not at risk for a syndrome that's not great in younger children. So every time that you provide information to us, you're immensely helpful. And I just wanted to make sure that you knew how valuable that information was and how grateful we are that you take the time to get it to us in a timely manner. And of course, the goal is to keep kids healthy and in school and parents at work. And as a parent, my hats are off to you. Thank you.
Thank you, Marilee. And Marilee and I were discussing, what would you like to know as ECE directors and facilities in the future focusing on communicable diseases? So any disease that can spread from person to person. And we would appreciate that feedback. There's 3 different ways you could send it to us. One, you could just type it in the chat right now, and Marilee and I will take a running list of all of those. Or you could just email me at the healthece@bouldercounty.org inbox, or we're looking at doing an upcoming survey. But the sooner you get the material to us about what you're interested in learning about communicable diseases, the sooner we can prepare and meet your needs as you need them. So thank you for letting us know. Feel free to put anything in the chat right now if you'd like. Next slide, please.
Thank you, Martha. I think you and Marilee did a great job of covering it. And Chris is going to give us some updates on the emergency management. So I'll turn the slides over to you.
Thanks, Jane. Hi, everyone. It's great to see you. Again, my name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. And I just, before I jump into a discussion with you all, I just wanted again to, it's been a while since I met with you. And I just want to thank this group again for your just tremendous leadership and work with children, early childhood community, and working with us at Public Health. I was just looking, we deployed our emergency operations plan as an agent, a public health agency for the COVID pandemic on January 24th of 2020. So it's amazing to think we're 3 years into this response together. And I've been in meetings with you all that have been challenging. And I just want to thank you all again for for your leadership and support of the community. I'm going to share my screen here and get started. One thing, where we're at in the pandemic, it is certainly nice to be at a time where we can look at preparedness planning and getting back to ensuring that the safety of children that are working in early childhood that you're working with and supporting. So I'm just going to go over just some brief things here just to so we can talk through and just think about some of the preparedness we need to do, some of the hazards we see in the county, hopefully answer some questions about how you can be notified about evacuation warnings, et cetera, and just really encourage you to really think about your emergency plans, your evacuation plans, and some of the support we can help you with there. So jump into that. Also joining me is Colleen Sinclair. Colleen is an emergency planner with Boulder County Public Health. Certainly answer some questions as we go along. You're welcome to stop me as we jump into this a little bit. So this is actually from a presentation we've also given to our providers on the long-term care and assisted living homes that work with community members living there. And I think what we know is after we've seen many fires recently, mass casualty incidents, mass shootings, floods in the past, severe winter weather, we know that this is not going to change. So we want to continue to keep these relationships with you all and make sure that we're all working on preparedness and not being caught unprepared. So this really is not going to change. We know climate change is impacting this as well. So it's clear that these hazards are going to continue with Boulder County. From a public health side, I think you all probably know this, many of you that live in the county for a while, some top hazards we see and we prepare for, particularly for larger responses. Certainly fires and floods, natural disasters, as we've seen with the very recent cold that you all might have been impacted by, severe winter weather. We clearly see outbreaks. We prepare for mass casualty or mass fatality incidents, whatever they may be. Worst case, a hazardous materials incident, and you all might have been impacted by communications or technological outages. So those are things we work with, prepare for as a public health agency and along with the community. I just wanted to reinforce that we unfortunately in Boulder County have a lot of practice, and so we have a really robust response structure in the county. Public health is a big leader in that and work within that. So with this group, again, we just want to continue to stay connected with you and let you know that we are part of that broader response structure. I know this is probably hard to see. We'll send this out afterwards, but we work with other agencies, other partners in the county, in the city of Boulder, work along with the Longmont Office of Emergency Management as well. And really work in a kind of all hazards response. So anything that comes to us that really escalates into a significant incident or ultimately a disaster, which we've seen in Boulder County, we work within this structure and work to support groups like you. I was doing a little research, and on the early childhood side, there's not a lot of good information out there about a hazard vulnerability assessment. I did like this graphic, and something you should consider is really thinking about the things that might impact you in your organization. So would it be a natural disaster? Would it be a fire? Would it be workplace violence, something like that? So consider those hazards. This really is going to be some of the pre-planning I think you need to consider. Consider some of those vulnerabilities, then clearly the children that you are working with and educating. Those are going to be, I don't like the term assets, but certainly something that could be a vulnerability for you all to work at and keep safe in the community. And then consider those impacts, what that could look like. So just impacts on families, impacts on your staff, impacts on your ability to operate. And then work back from that. Think through those scenarios and think about your plans and how you're going to work to address those should we see an incident, a disaster in the community. So I just keeping things really high level, but just really getting the wheel spinning, getting us all back together to preparedness. So one thing you can look at is really just drawing out a scenario. You have a wildfire where you might a wildfire scenario that might impact your organization, your operation, and you have to evacuate. What does that look like? What partners are you working with? How are you working with families and caregivers? Do you consider an evacuation versus sheltering in place, for example? And then really dig in your policies and procedures, look at how you're going to communicate together, look at your transportation options, and also work towards testing and training. So just something that, again, just to get the wheel spinning. We can certainly come back another time and dig into this a little deeper. But as we start to roll in the year, we wanted to discuss this with you all. Okay. Just one thing I know that it might be helpful for us to discuss is alert and warning and some of the dynamic or some of the issues that are going on with that in our community. There's a couple different options or a couple different ways that you would be alerted should it be a wildfire or a flood, for example. One is called a wireless emergency alert. So those are the ones that, as you may be familiar, we had a fire in Longmont last year that there was warnings that went as far as Wyoming. There was warnings that went to Superior, and the fire is actually in Longmont. That's actually a system that's a federal system that is, it needs to be refined certainly, and is not perfect. And so it is something that basically is similar to the Amber Alert you see out there, where you get those alerts. And what it does is there's a defined boundary, and it hits cell phone towers, but there's a lot of dynamics. There's a lot of issues that come up with that where you might get an alert. You are able to sign up with our Office of Disaster Emergency Management in Boulder County to get a direct alert. And that's based on your location, your address. And it really does help, and it is most accurate. There's something impacting you, will get this alert, and we'll talk about how you can sign up for that. I do believe in our Office of Emergency Management, there's also ways of getting email updates. And so we'll point you to the page where you can sign up for that. Don't want to go too far in this. I'll share this in when we share the presentation. This just talks about why that wireless emergency alert is maybe inaccurate at times. There's just a lot of partners that are involved, including the emergency alert system. We have NOAA that's involved in that, wireless emergency alert. So it's really, there's several partners or several stakeholders that come into play that sometimes then push that out a little more broadly than it needs to be. So what I would consider, if you haven't done so, is to sign up for your organization with Everbridge on our Office of Disaster Emergency Management. We'll send this information out to you if you haven't done so. Put your addresses in there, and then you will definitely get those direct notifications. It has directions on there. What I want to skip to is just really talk about the importance of if you receive those alerts. You really should take a step back and think about situational awareness. Check, really maybe go outside and look outside and see what you're seeing, if it's safe to do so. Go to the emergency status page where that Everbridge alert came from, and really check on if things are accurate. We'll know pretty quickly if, again, if that scenario where there's a fire that's really not that close to you, you just need to check on that and verify information. Sometimes in the early stages of an emergency or disaster, information might be sparse. So really check lots of sources. You can check social media. And really dig into, really go to that trusted source of our Office of Disaster Emergency Management to verify these alert and warnings. And then you can start to make decisions on, should we consider evacuation? Should we consider staying in place or sheltering in place? Some other, and again, this was one for more of our other healthcare facilities, but you might want to consider your impacts, your HVAC, your systems you have there, your air systems that are bringing things in. You might want to turn that off if there's a lot of smoke, something to consider. But really, another thing is, you're ultimately up, you and your leadership, your directors, your teams, your leadership teams are really empowered to make those decisions. If you feel at a point and you're not feeling safe, really make that decision quickly and feel confident about it to evacuate or shelter in place. So yeah, that was just a real quick overview. I just want to touch on a couple things in terms of preparedness and individual preparedness or organizational preparedness. I will say that on the emergency management side, we do maintain an on-call person 24/7. So don't hesitate to call that number if you have questions. Again, I think the important thing is for you and your organization to really consider, and I know many of you are required to do emergency plans, evacuation plans. So really look into that, but just know that you're not alone. You have this team supporting you. You have our emergency management side. You have our Office of Emergency Management there to support you. So just keep that in mind. And I think I'll stop talking there. I knew it wasn't quite as interactive as the last one, unfortunately, but just want to share some information. So happy to answer any questions.
Chris, there's a question in chat about a possible mountain lion on campus.
Oh boy, that's an interesting hazard. Maybe Colleen can take that one. So Colleen lives up in the Peak to Peak area and sees a lot of has seen a lot of activity with mountain lions recently. But I do think that is more of an animal control side, or the law enforcement might be able to inform you on that. So I think, again, worst case, you do consider calling maybe that non-emergency number for 911. But ultimately, if you do not feel safe, I would call 911 and they will route you to the proper area. I do think that, again, on that animal control side, they might have some information they can share with you to remain safe. I wasn't expecting that one. I should, though.
It's a good one, bears and mountain lions. Yeah, and Colleen is saying, yeah, dispatch. I assume that's 911 or non-emergency.
Yeah,
Yeah,
exactly.
correct.
CPW you can give a call to make a report, but they're not necessarily going to act quickly. Or if you call dispatch, they can get the wildlife officer on call over there, or the sheriff, or whoever's available. Right.
Yeah, and that would apply to really any wild animals, correct? Skunks we've seen that might have be acting differently, or any other wild animal.
Correct. Okay. Well, again, I just want to thank you all, and I do encourage you to really consider looking at your emergency plans again. And again, it's about just being prepared, having those scenario-based conversations, walking through that with staff, and really, again, it takes a little bit of work ahead of time, but I think it'll be really beneficial to start to look at that into this new year. So I really appreciate your time, and again, feel free to reach out if you have additional questions.
Thank you, Chris. And I'll just add that if you want more of those emergency management planning, you can add that to your list of what you'd like to see on this call. And we can break it down. The more specific, the easier it will be for us to respond. So I really appreciate that. Thank you, Chris. So we'll do a partner update if we have Jody from CCAP available. Anything to update us on?
Hi, thank you, Jane, and thank you to all the public health staff. Always great information shared. I wanted to express gratitude for everyone who has, all the partner agencies. It's just been partner programs who have renewed. We've had over 250 renewals of contracts in the last year, and then I meant to have the exact number, but about 25 new and returning programs. So that's been so great. Thank you. And then in just a second, I'm going to put in the new. There's been a lot of enhancements and improvements to the program in terms of payment and absence policies that I wanted to share with you. So I'm going to put that information in, but just to kind of put it out there and remind folks who are already participating, absence payments are up to 6 days paid for quality ratings 1 and 2, and up to 7 days paid per month per authorization for levels 3 through 5. And then I've heard a rumor out there that there's a wait list for CCAP families. There is not. It does sometimes take us a little while to process applications. We're doing pretty well right now and getting them within about 5 days. And that won't last in the fall, and in the summer it'll go back up to about 10 days. But there is no wait list to qualify and be eligible for families for CCAP. So again, I'm going to put the new center rates that just were updated in October, since there were increases almost across the board for reimbursement rates to programs. And just hoping, some of our new partners that are out of county, hoping to get some new partners within the county sign up for some CCAP spots. Any questions? My information will pop into the chat here soon, and I'll be on until the end of the call. So thank you.
Thank you, Jody. Do we have Amy Carlo or Marilee for the Early
Hi.
Childhood
Hello.
Council, please?
Hi. So we have 2 EQIT cohorts that are starting here next week and the week after. Our Tuesday class is full, but there are still spaces available in the Saturday cohort. I think we have about 5 spots left. If you have anyone in your programs that's interested in taking expanding quality in infant toddler care, they can register on our website. And we're also excited to be offering another touch points training in the end of February 23rd, 24th, and 25th. And that's an excellent opportunity as Universal Preschool's coming soon to just learn more about parent-child and provider and family relationships and strengthen your relationships with families. And we're finding that it's just great for staff retention, and we are looking forward to offering that in the end of February, and we'll have reflective practice session dates that we're still working on. Those will be on Wednesday evenings, probably in March, and registration will open soon for that. And I also wanted to invite anyone who's interested in joining our professional development committee. Our next meeting is the first Wednesday of February. They're always on the first Wednesday of each month, and they're online via Zoom from 10 o'clock to 11 o'clock. And in these next several months, the PD committee is charged with looking at developing a kindergarten readiness statement, as ECCBC is as you all know, the LCO local coordinating organization for Universal Preschool. So we invite you to, if you are interested in being part of those conversations, to come join the PD committee meeting. And I will put my contact information in the chat here. Anyone has any questions about that? And I think that's all.
Thank you, Amy. I'm never sure if someone from the Colorado Department of Early Childhood is available, but if you're on the call and would like to give an update, we reserve this space for you.
Hi there, can you hear me?
Yeah.
Hi everyone, this is Shannon with licensing. I just first and foremost want to say thank you each for all you do. It truly takes a village, and so I just appreciate each and every one of you. It's a very exciting and busy time for us all, as it seems to always be. But with the creation of the Department of Early Childhood, there is a Rules Advisory Committee that is meeting, or sorry, Council, Rules Advisory Council that's meeting. If you aren't receiving those updates, I would encourage you to look into it. Now's the time to definitely speak to those rules and provide public comment. And so that information I will throw in the chat for you. Let's see here. Looks like I'm going to need to shorten my message a little bit, but I will put that in the chat. And
thank you,
so much.
Shannon.
That's all I have right now.
Okay,
you.
and thanks for all of your work. I know you are all under a heavy lift as well. So thank you, Shannon. And now I'll turn it over to Kyla for our child health promotion training snacks.
Hi, it's good to hear everybody. I'm glad you're all here. And Chris, thank you for that, because I was in one of the pre-evacuation zones of the fire the other day and was like, I'm not ready for this. So again, a nice reminder and a resolution that I have this new year to make sure I'm ready for an emergency. My name's Kyla Perlman. I've been with Child Health Promotion for about a year and a half, supporting mostly the healthy eating and active living portions of what we do. And if you've taken any of our HEAL trainings in the last year and a half, you've probably seen me. I'm usually with Tori. She's our nutrition guru. And so always a nice, if you have any like really complicated nutrition questions, she's your person. Well, she and I and Heather Houseworth, who runs our Farm to ECE program, want to invite you to spend your next 2 second Mondays of the month from noon to 1 with us as well. So this ECE provider update that you've been getting for the last couple of years is going to quarterly. But since maybe you already have the second Monday of the month reserved on your calendar from noon to 1, we wanted to take advantage of this opportunity to provide some training snacks for you, and just sort of whet your appetite with what other types of healthy eating, active living, farm to ECE types of trainings that we provide. So we've scheduled the February training and the March training just to see how you guys like it and want all your feedback, of course. These will just be, I think for February, we're going to do kind of a high level overview of healthy eating and active living for some of you who this is a brand new topic, or it's been a long time since you've had a training on HEAL and want to get up to speed on what's the latest, or just remembering what you already knew and have forgotten. And anyone is welcome. So directors, cooks, teachers, anybody in your facility, we would be happy to have you. And then let's see, next slide. Yeah, so this is our sort of plan for the next couple of months anyway, is doing a healthy eating, active living in February, something related to farm to ECE in March. There may be other timely announcements. We might, if there's something going on with communicable disease, we might have Martha step in and give us a little update or something. And these will be, you will earn 1 training hour for the health, safety, and nutrition for your Colorado Shines points. And next slide. And then also in the world of HEAL, Tori and I will be reaching out to all of the currently recognized HEAL programs at the end of January, the beginning of February, to do a renewal, as all of us have been a little off kilter since the pandemic started. It's been a while since we've done a check-in, so we just want to make sure that you're still able to meet the HEAL certification requirements, HEAL recognition requirements, to be a HEAL-friendly childcare, and provide any support that you may have if you've slipped in an area, as we all have in the last couple of years, and just help you maintain that recognition. So that you'll look out for that. That'll be coming soon from me and Tori. And if you're interested in HEAL recognition, but you haven't done that in the past, please definitely reach out to us because we would love to get you on board. We are also providing in-person training at your program. I know that not all of you, but many of you have professional development days or staff meetings set aside for trainings, and staff from Child Health Promotion can come and provide support in training, healthy eating, active living, farm to ECE, breastfeeding, whatever your particular thing is that your facility needs some support with. We'd be happy to come and do a training for all of your staff. And we know that in-person training doesn't work for everyone all the time, so we're still have virtual training as an option. So definitely reach out and let us know if virtual is going to work better for you, and we'll work with what you all need, because that's what we're trying to do, is figure out the best way to support your programs and meet your needs where you're at. So if you have any questions about the February and March trainings that we'll be doing on the Monday at noon virtual, or any in-person trainings that you're interested in, or anything on HEAL recognition, please reach out to me. I'll put my contact in in the chat as well, or really anyone at, in child health promotion can get you in touch with me or Tori to help support you in this. And that's all I've got.
Thank you, Kyla. And I put these links in slides just so that when we send this out with the recording, you'll have it, but we'll also do a reminder. I just put those two in so that when we send them out, you'll have them. And now's the time for any questions. And we've Kyla reiterated, I put this on our final slide, but that first Monday of each quarter will be more like today, with some communicable disease, maybe some agency updates. And then the other 2 months of the quarter will be child health promotion. And that's where we really need your input on chat, via the Health ECE, or you can email me directly with what topics would best meet your needs and how we can support you. So I'm going to drop the screen and leave it open for any questions. I know Kara's been, can I tracking those questions? Kara, any questions?
Yes, thanks, Jane. So I did see in the chat that Martha had found a electronic version of the illness surveillance form. But Martha, there's also a comment in there that maybe it's not linking correctly. So I just wanted to make you aware of that. And I think maybe, Jane, what we should do is when we include the minutes of the meeting, include that
Sure.
electronic illness report so everybody can have that. Let's see.
Yeah.
There is a question about COVID being on the rise. Any updates, Martha, about that?
Yes. Yes, that is true. We're watching it. It seems as influenza and RSV are decreasing, COVID is increasing. So continue to follow what you know so well from what you've learned and done over the last 3 years, and please reach out to us with more information, for more information. And again, with reporting, I've had quite a few questions in the Health ECE inbox of whether people should report individual cases, but the answer is no. Just if there's 5 cases or more, and 2 of them need to be a PCR test within a 14-day period. So, but keep following all the good things that you learned with good hand washing, disinfection, sanitation, isolation, keeping sick kids at home. So, but going back to the illness log, could some other people use that link and see if they're getting the same thing, whether Pueblo is popping up? Because I just copy and pasted it again, and mine didn't show Pueblo, but I want to make sure. You could just put feedback in the chat. That would be super helpful. Because our Boulder County Public Health, her name is Debbie Martinez. She just made it while we were live here. It's pretty amazing. But I want to make sure that it is usable. So if some other people could open it as well, that would be helpful. And maybe I need to download it and upload it, but link says I don't have access, says Kyla. Okay, thank you for all this feedback. We will make sure everyone has access. Ask for a login from BCPH. Okay, thank you so much. We will work on this, and then Jane, I think, will send out an update to all of you once it's working well.
Yes,
thank you.
Or what else do you see in chat?
You know, there's not a lot of questions.
I see one on COVID is on the rise.
Yeah, we just talked about that. And then there's comments earlier on in the meeting, I guess, for those who are on the phone who can't see the chat, is about the closing of the community COVID testing sites. I'm trying to go back in the notes, but I think it was the 15th, January 15th of this year is when they are going to close. So that's good information to share with the families and staff.
Marilee answered a couple questions that you might want to read. I'm not sure if some people are on their phone. It looks like they are.
Yeah, I'm sorry. There's just a lot of answers to the general questions that were asked during the meeting, so I'm trying to pick through some of those questions. There was a link to the illness form, the illness surveillance form. Again, just a general link to print out, but like Martha said, we'll work on getting an electronic version. And feel free if anybody is seeing things as I go through, speak up. Yeah, I think Jane, let me see if it's.
Shannon's link I will include in the notes
Yeah.
from the Rules Advisory Committee. They call it the RAC committee. If you haven't seen that, I'll send that. And Marilee, Martha, anything you'd like to add?
No, I think we appreciate your quick feedback, and Debbie's working on making the fillable Excel that everyone can have access to. I look to it's a read only, so she just has to change one setting and then you all should be able to use it. So thank you for that quick feedback, and thank you for typing it in. That will speed up our ability to close some of those outbreaks. So thanks so much.
Yeah. Amy, Amy Carlo is, there's a question about ECCBC UPK updates or trainings. If you want to point them to the Early Childhood Council website that might address that, or you have an answer to that? For the UPK?
Sorry, Jane, can you repeat that question?
Yeah, there's a question about the UPK. Maybe the local control organization website might have some of that update on trainings and so forth. I know that.
Yeah, there should be more information coming out from our team here soon. We are in the process of hiring a UPK director, and we should have more information coming out from our team here soon. I don't have that information, but stay tuned. It will be coming out. Perfect. Thank you. And I know there's a page on the ECCBC website that also is being updated. Yeah, I'll put that in the chat. Thank you. Any other COVID specific? Marilee's asking for any COVID specific. I saw a comment regarding the variants. I think that might have already been answered, but if there's any other. Yeah, I think that emergency management information was really helpful. I agree. Thank you, Chris and Colleen and others that contributed to that. It's always on our mind, right? Right, then I'm about to give you 10 to 12 minutes back to your day, unless there's any other questions. Debbie, I don't believe we can answer anything about PDIS challenges. That's unless Shannon is, that's an Office of Department of Early Childhood question. I don't know if Shannon is still available to answer any of that. But thankfully that one is not on my list.
My apologies. I'm on phone duty today as well.
Oh, thank you, Shannon. They're just a PDIS challenges. Debbie, do you want to
open my email?
If it's a specific question, Debbie, maybe you can contact the phone line.
You know what? I think in general, it's the conversion and trying to get everything migrated into one place. And it just seems like it hasn't been, the system isn't responding seamlessly. So there's been challenges with getting people onto a certain level and then just the general migration. So I just point that out. Maybe you've already, you're hearing about this.
Yeah, there's been quite a few pieces with PBIS, but the best advice is to reach out to the help desk by email, and they should be able to help with that migration of the accounts.
Thank you, Shannon.
Absolutely.
All right, then, unless there's any other questions, I really, again, appreciate it. We are really excited to start a new year with maybe a fresh start. And we will be in contact regarding the updates that we'll use the other two meetings for, but I'll send out this PowerPoint and this recording so that you'll have access to that information as well. So thank you all. Enjoy the rest of your day and Happy New Year.